Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Insomnia isn't just fatiguing. It could be aging your brain faster. Study. Chronic insomnia may accelerate brain aging and significantly increase the risk of developing cognitive impairments, including dementia. The findings published in journal Neurology suggest that sleep problems in older adults are not just disruptive but could have long-term consequences for brain health. Chronic insomnia, defined as difficulty sleeping at least 3 days a week for 3 months or more, was associated with a 40% higher risk of developing mild cognitive impairment or dementia. The study followed 2750 cognitively healthy adults with an average age of 70 for an average of 5.6 years. Of the participants, 16% had chronic insomnia. Each participant completed yearly thinking and memory assessments, and a subset underwent brain imaging to examine signs of small vessel disease and amyloid plaque buildup, both markers associated with Alzheimer's disease. At the start of the study, the participants were also asked whether they had been sleeping more or less than usual over the prior 2 weeks. AI reads mammograms to predict heart disease risk in women, study finds. A novel artificial intelligence algorithm using only routine mammogram images and age can predict a woman's risk of major cardiovascular disease as accurately as standard clinical tools, according to a new study published online in the journal Heart. The research suggests that mammography, traditionally used to detect breast cancer, could serve as a cost-effective 2-for-1 screening tool to also assess heart disease risk in women. Cardiovascular disease remains underdiagnosed and undertreated in women, in part because traditional risk assessment models often perform poorly in female populations. While newer algorithms have improved accuracy, they typically rely on detailed clinical data which is not always readily available. The study analyzed data from 49,196 women with an average age of 59 who are part of the LifePool cohort registry in Australia between 2009 and 2020. At the time of enrollment, participants provided basic health data including lifestyle factors, menopausal status, and medical history. Over an average follow-up period of nearly 9 years, 3,392 women experienced a major cardiovascular event such as coronary artery disease, heart attack, stroke, or heart failure. Study reveals Mediterranean diet reduces gum inflammation. People who closely follow a Mediterranean-style diet may enjoy healthier gums and reduced inflammation, according to a new research from King's College London. The study, published in the Journal of Periodontology, suggests that dietary choices, especially diets rich in plant-based foods, could play a vital role in preventing or reducing the severity of gum disease. The Mediterranean diet, known for its emphasis on vegetables, fruits, legumes, whole grains, olive oil, and lean proteins, has already been linked to reduced risk of heart disease, neurodegenerative conditions, and certain cancers. This latest study adds oral health to that list. Researchers found that individuals who did not follow a Mediterranean-style diet, particularly those who consumed red meat frequently, had more severe gum disease and higher levels of systemic inflammation. The team evaluated 200 hospital patients who were enrolled in the King's College London Oral, Dental and Craniofacial Biobank. Each participant underwent dental examinations, provided blood samples, and completed dietary questionnaires. The data reveals that those with plant-based diet, typical of the Mediterranean style, had lower levels of inflammatory markers such as interleukin-6 and C-reactive protein. In contrast, higher inflammation was observed in those who consumed more red meat and fewer plant-based foods. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.